South Africa. They're using different names, but it's still Pharaoh. Satan is behind it all. Let us pray that they will heed our warning. For the wrath of God is on its way. There's still time for change and forgiveness. The church is drawing closer every day. For the black, for the white, no purchase in his sight. From my people. Well, not another holocaust with the many so far long. To my people. Yeah, you can't do as you please. No, not with these. To my people. Yeah, yeah. I can hear the Spirit saying, let them go and right away. To my people. Well, he said it back then. Said it, now he said it again. Let my people. These are my people. Well, say it one more time. They said it back then. Now he said it again. Let my people.
We have a panel of doctors here with us at this time, and we're talking about allergic conditions. Herb, a person says they get dizzy when taking Sudafem. Could you respond to that?
Sudafed is one of many medications that's used as a decongestant medication. And certain people are sensitive to these medications. In fact, people that have high blood pressure should not take these medications without a physician's advice. And sometimes some people will get some dizziness associated with the medication, either at a normal dose or perhaps if they're taking a dose that's higher than what they require.
What is this a common medication?
It's a very common medication. It's found in many over-the-counter preparations and in many medications that require prescriptions. It's one of the two most commonly used decongestants.
And if a person is getting dizzy like this, you'd recommend them to see their physician?
Yes, I would suggest they see their physician and complain about the side effect that they're suffering from that medication.
Okay. And Gordon, could you talk a little bit about nasochrome? Somebody asked us, our viewers are calling in with these questions.
Right. Nasochrome is a medication that is used to prevent allergy. It doesn't really treat the allergy. You have to take the nasochrome. This is a medication that is sprayed into the nose, and the way that it works is that it is applied to the lining of the nose, and the scientific term is that it stabilizes the cells in the nose to not release those substances which would make you sneeze or become congested. So therefore, you have to have this medication in place first before you would be exposed to the substance that you're allergic to. It's an excellent medication and works very often.
Heard one viewer called in and said, working with tomatoes, can they give you a rash by working with them?
Well, tomatoes can certainly give you a rash by eating them. Contact reactions to vegetables are usually or more often due to some of the preservative agents which are found with them, in particular some of the sulfites and some of the other agents. And also some of the weed killers and some of the other things that these vegetables come from the store with. So it would really depend on the preparation, whether this was just touching a tomato or whether this was eating a tomato brought out the skin rash.
I'm personally not aware of anything I'm really allergic to, but as a person goes through life, you can suddenly come in contact with something, can't you, that you may not have known that you were allergic to?
That's true. That's a very good question. Allergies has often been described as a disease of the young, and for the most part, that is correct. In other words, allergic diseases do occur more often in children and in young adults than in older people. However, the best example of what you're asking about would be, for example, a sensitivity to penicillin, let's say. Often what you will have a patient who comes into the office who comes to see you because of an allergy to penicillin, and the first question or the first statement they will make will be, well, doctor, I've been taking penicillin all my life and never had a problem. Well, that doesn't, just because you've taken a medication on previous occasions does not preclude the possibility of developing an allergy in the future. In fact, by definition, in most situations, to develop an allergic reaction to any substance, you have to have a prior exposure to that substance to then develop the clinical symptoms. So yes, that can occur at any time and really at any age, and penicillin is just one example.
Okay, Herb, somebody asked this question. Now, can you become allergic to things internally, so to speak? For example, somebody called in and they wanted to know, for example, say, I don't know if this would have to do with, say, the inside of your ears you'd break out, or the inside of your nose, or something like that.
Mm-hmm. Well, allergic disease, as was mentioned before, can be manifest in just about any organ system in the body. Mm-hmm. So that if a person, let's say, has hay fever, then the manifestations of their illness will generally occur in their nose. They'll have nasal congestion, runny nose, itching in the nose, sneezing, and the like. Whereas if a person has asthma, their problem would affect mainly their lungs. Intestinal complaints can occur as well in reaction to foods or other allergens, and other problems may occur as well that could involve other body systems.
Somebody asked what causes the inside of the ears to itch in the same way.
And again, what's happening is the chemicals that are stored up in allergy cells are released into their immediate environment, and these cells interact with other cells in the tissues, and one of the things that they will do is stimulate nerve endings that will cause an itching sensation.
In the ears?
In the ears.
Okay, because we're getting these calls from our viewers that are calling in, and we do invite you, if you have questions that you want to ask the doctors, you feel free to call at this time and participate in this particular program. And I'll be going over the phones in a few moments again, but the phone number, toll free anywhere in the state of Missouri, 1-800-334-3276, and in Illinois, 1-800-242-3276. Now, Gordon, I want to ask you, this time of year, we've mentioned ragweed. Is there other things at this time of the year that we really do discover that we might be allergic to that we don't notice the rest of the year?
Yes, there are. At this time of the year, in the early spring, for instance, we are going to see that the molds are going to be very common, particularly in early March, as we begin to get our spring thaw. There will be quite a bit of mold in the air. Then followed by that would be perhaps in April, we will see the trees pollinating, and the pollen from the trees would be very common, followed by grass pollens. This year they're a little early because we had such a warm spring. So that we have really certain seasons. We have a mold season in the early spring and in the fall. Primarily. We have a tree pollen season from, let's say, late March to maybe the first week in May. Grass pollen season from, say, Memorial Day to July 4th, and a ragweed season from, say, August 15th for about a month or so after that.
How many people have allergic conditions? I mean, is this, if a person has one, are they in a minute minority, or could you say out of how many Americans, one out of how many every so often?
Well, there are about 31 million Americans who are affected by allergic diseases.
31 million?
31 million.
That's a lot of people.
It's a lot of people. These diseases are very common, and often people have disease that is really not severe, so that they treat themselves and they manage without medical care. So a lot of these people are not diagnosed and don't become part of the statistics. A lot of people have the symptoms of hay fever, such as runny nose and congestion, and don't have any allergy that we can demonstrate. And we see these people also, and perhaps twice as many people suffer from these conditions, which we call vasomotor or non-allergic rhinitis. So this is a very significant number of people, and there's a lot of time lost off work and a lot of money spent on medications.
All of you are doctors. What do you refer to doctors of? What do you refer
What
to
are our
yourself
as allergist, and also you may be referred to as clinical immunologist, allergist and clinical immunologist.
31 million. They're not all beating on your door at one time.
No.
Okay. Do you all see some very acute cases? I mean, we often think of a rash breaking out or somebody sneezing,
Absolutely. And I'm glad you bring that up, because as Howard mentions, many people, a significant portion of that 31 million may have fairly mild symptoms. But there are a lot of people out there who will have acute symptomatology. Certainly with asthma, you will see individuals who can have an acute onset of very significant symptoms in terms of their ability to breathe, and that will certainly be something that you will see. And even in terms of hay fever, which is considered a very benign disease, people can, in the middle of the time of the year, as Dr. Blumberg was referring to, that they're sensitive to, they can have some very acute symptoms with incredible nasal congestion, sneezing, headaches, and just really feeling miserable.
Herbert, how much of this is physiological and how much is psychological? Do you get in the psychological realm?
Well, that's a very good question as well. Many people think that allergies are all psychological, but unfortunately that's not the case. Most of what we see is indeed physiological. The symptoms are brought on by a release of mediators that's triggered by an immune response in the body. And sometimes, in some situations, we may see a child who presents, for instance, with a chronic cough, who after a complete evaluation we're unable to find a cause that we could call truly allergic, and that child might have a tic or some psychological problem that's presenting as a chronic cough. But most of the time, 99% of the time, what we see is a physiologic response to an immune response in the body.
Do you work with psychologists if you feel like there's a psychological problem involved?
Very frequently, we develop close ties with different psychologists, not so much for the management of those types of problems, but for other associated problems. Oftentimes these children, because of their frequent problems, will miss a great deal of school and have school problems that sometimes require the intervention of a psychologist to help the children get their studies back together and help them develop more economical use of time. Unfortunately, in the society that we live in, many families go through divorces, and when you have a chronic illness to begin with in the family, oftentimes a divorce can lead to very significant problems that have to be dealt with sometimes with the aid of a psychologist.
We're getting a wide range of questions. Many of the viewers, many of you are calling in with all kinds of questions here, so I'm going to continue to just keep asking the doctor some of these questions, and you have to tell me, like some of this stuff is all new to me. I'm learning along with the rest of our viewers here, so if you get a question that you don't quite understand, you let me know that, because I may not either. I'm just taking it straight as the people are sharing. But some of this stuff is brand new. Sun fever, is there such a thing? Why do I sneeze? Can people actually, we talked about the psychological, the physiological. Now would something like that be psychological? Why do I sneeze when I see the sun?
I wouldn't think of that as being psychological, but I wouldn't think of it as being allergic either. I think that if a person goes into the sun and has symptoms, the symptoms are real, but the cause is probably not allergic.
Okay. Yeah, we have a lady that's called in here. She's 65 years of age. Gordon, she has an emphysema, an allergic condition, and she's now taking medication, and by the name of, I hope they got it spelled right, A-L-U-P-E-N-T?
Alupent.
Okay, and then another medication, A-M-I-N-O-P-H-Y-I-L-L-A, 4 times a day. Is there anything new or better for that at this time that the doctor would know of?
Okay. This lady who's calling in has a chronic disease that is not allergy related. we could certainly talk about this because some of the medications are very similar. These particular medications are twofold. The Alupent is a medication which is often prescribed as an inhaler, which relaxes the bronchial muscles. It's called a bronchodilator, and If somebody doesn't respond to that particular bronchodilator, then there are a whole group of other ones that are related that may be more potent or may act for a longer period of time. And so a physician can prescribe bronchodilators with different characteristics and which are more potent if need be. Aminophylline is a medication that works in a different way, but also works in a sense to relieve the constriction in the smaller airways. This is a very widely used medication, and a lot of care has to be taken to make sure that the dosage is right. And for this reason, doctors frequently measure the blood levels of the medication. So if the treatment that's being given is not adequate, then one should get the doctor to measure the level of that medication in the blood. But there are a number of other medications that are available. We talked about nasal chrome. There's a variant of that's available for use in the lungs as an inhaler, and some other new medications on the horizon for that.
People are looking all the time for that miracle drug, it seems like. And the question is can any current research that's being done, just like they're trying to find a cure for cancer, are they going to find a cure for allergies, or are they leading to a cure maybe they'll find something one of these days they won't have this problem anymore?
Right. I would not say that there's a cure on the horizon, but I would say there are a lot of encouraging things that not only are going on in research, but that are really present in actuality, but just hasn't been made available yet on the commercial level. And what I'm referring to there is the allergy shots. Just briefly, the allergy shots is the one way that the allergist, following the intervention with environmental control and medication, as Dr. Druce mentioned earlier, we then turn as the third approach to treatment of allergies with allergy shots in certain conditions. And in that way, we are trying to decrease an individual's sensitivity to what they're allergic to. Now, there are a lot of things on the horizon in terms of the selectivity of that type of treatment and our ability to administer that type of treatment with less concern with reactions, and to be able to accomplish the effect that we're looking for in a much shorter period of time. So I think that's very exciting. And then just to reiterate what Dr. Druce was referring to, in the last 5 to 10 years there's been an enormous amount done regarding the production of different kinds of medications that are available to us now that weren't available 5 to 10 years ago.
Maybe you're one of that 31 million that are suffering from an allergic condition, or maybe a member of your family is, or a friend or a neighbor. You have questions. Now's the time.